A survey conducted by a leading health services provider in the United States of America reports that about 40% of pregnant women suffer from yeast infection. The statistic may not be good enough to deduce that all pregnant women suffer from yeast infections, but the logic behind the occurrence of yeast infection in pregnant women is worth a thought. During pregnancy, a woman's body experiences many hormonal and chemical changes. With the change in the hormones and the chemical balance of the body, the onset of yeast infection could be very difficult to treat. In such cases, pregnant women find it very difficult to deal with yeast infections and hence report symptoms of this infection recurring in them. That said, not all pregnant women suffer from yeast infection. Women who have not followed basic health guidelines are often considered to be at a high risk to contract yeast infection during pregnancy. Even doctors find it very difficult to treat this infection in women who are pregnant because they ought to exercise care in the medication prescribed to the patient. If you're planning for a child sometime next year, start thinking of how you could do the simple things now so that your pregnancy is an uncomplicated affair. What you do now may make a lot of difference in the health of your body and baby in the long run. By now, you would know why it is important to take simple health measures to keep both in good shape.